Health equity, health equality. They sound similar, but they're not the same. And you hear a lot about those terms. When we talk about equality, that means people have equal access to something. So let's say everyone is given a scale or they have access to a scale. But it's not really equitable if everyone can't be weighed. So they have equal access, but not everyone can be weighed. Maybe people who can't stand up on their own may not be able to be weighed on this particular scale. So health equity would be where everyone has equal access to a scale that can accommodate their different levels of abilities, their ability to stand or the need to be weighed in a wheelchair or whatever it might be. Another place that we see health equity or health equality is we might say, well, everyone has access to a primary care physician. Well, that may be true. It's not always true, but it may be true for the purposes of this example. But let's say that physician is not trained to meet the healthcare needs, the primary healthcare needs of a person with intellectual and developmental disabilities. So people might have health equality. Well, yes, they all have access to a physician. But is it equitable when the physician may not know or may not have been trained on how to meet that person's needs? So when we talk about health equity, we mean making everything accessible for people of all different levels of needs. And that's really important. And that's one of the big reasons I'm a big proponent of providing education to healthcare providers, to nurses, to physicians, to dentists, and to all people who support people with intellectual and developmental disabilities so that they have the understanding of how to provide the basic levels of healthcare to people with intellectual and developmental disabilities. So equity versus equality. We want to go for equity.